Welcome back to the Poultry Doc Podcast. Today we're walking through a real-world Bumblefoot case and addressing a common and persistent myth in backyard poultry medicine, that lidocaine is toxic to chickens and shouldn't be used for pain control. I'll walk you through how and why I use local lidocaine nerve blocks for these procedures. Let's get started. Welcome back to the Poultry Doc Podcast. I'm your host, Dr. Blayne Mozisek, and today we're in San Antonio at Amelia's house, and Amelia has a chicken, Dottie, who's got some bumblefoot issues. So we've looked at one case of bumblefoot before. If you remember, that was at London's farm. And today we're going to take another look again, and maybe a different presentation than we've seen in the past. And we'll go through different ways to clean it up and treat it, and talk about some of the other things that may be going on in our flock. So Amelia, you want to tell us a little bit about Dottie, how old she is, when you first saw it coming on?
So Dottie, she's my Speckled Sussex hen. I got her maybe 5 years ago. It was right when I first got my first chickens. So she's at least 5 years old. And I noticed that on her feet, they started swelling a little bit, kind of at the end of her feet is. And then it kind of slowly progressed up her leg a little bit. And it began to turn a little bit red. I examined her to see if she had any scrapes on her, and I didn't notice anything, so I was a little bit concerned about what was going on.
Yeah. And Amelia's a zookeeper, kind of, right?
Yes,
Formerly. So she's got a lot of animal health experience, so I'm sure she was keen on those feet getting swollen and wanted to do something about it. So yeah, she reached out about a week ago, and we were able to make it out, and we're going to take a look. So, okay, so this is Dottie. Amelia's Speckled Sussex, and again, we're here for Bumblefoot. We're taking a look. So both feet in her case are affected. They're warm and red. We'll take a closer look in a second. And not super swollen, so not, doesn't seem to be migrating too far up, although it is a little bit. And what we're going to try to do today is open this up a little bit and express that. Remember that material inside that is basically like dead cell material, inspissated pus we call it, so dry pus, and that is the immune reaction that has tried to clean up that infection. And so in birds, it really just turns into walled off, dry, sometimes hard material that we're going to try to get out of there. Many times this is as a result of a staph infection. We'll actually take a sample of it today. I'll show you how we swab it and send that off. And then what we're going to do is do an antibiotic sensitivity test, and that'll tell us what that bacteria is going to be susceptible to. We'll start her on something today, but it's really just to ensure that what we're using is the right medication. Okay, so we're going to make a little bit of this chlorhexidine solution. I may not have to be super accurate about it, but about a teaspoon in a pint. And then we're going to clean this foot up. You may read a lot and hear a lot about lidocaine being toxic. Those original papers are from the 50s, and there are more recent ones that say that it is not. So we are going to try to block this leg a little bit where she won't feel the pain, so she won't be able to feel her foot. So she'll be walking funny for a while too, because she won't be able to feel her feet. And she's got both legs affected. In her case, it's not super close to the surface, so we are going to have to make a little incision up here in that spot where it is the thinnest and where it's getting closer to the surface. But again, it's not that classic, black dot where we can easily express it out. So we're going to have to break the skin there a little bit. So what we're going to do with Dottie is, rather than taking a scalpel, which is a little bit large for her legs, a 14 gauge needle works really well. It's basically like a horse needle. So this would be a common needle to give like antibiotics to a horse. What's good about it, my kids are very familiar with these needles because I use them to take splinters out. So it's big enough where, it is a needle and you could inject things through it. We obviously don't use it for that for the purpose of chickens, but it works really good because basically the tip is a very small little sharp blade. And for the purpose of my kids, it's worked great as to get splinters out too, so if you ever need that one. But you can use it to cut the skin slightly and dig in if you needed to, like in the case of the splinter. In her case, again, this small little area, we're going to open it up and express that all that material, or as much of the material as we can get out. Then we're going to clean it up good again with the chlorhexidine. We've already done a good job of that, so feet right now are relatively clean. We've aseptically cleaned the feet. And lastly, once we get everything out and do a good job of cleaning up everything, we're going to show you how to use the pool noodle as a sort of shoe. This is a little bit unique case again where she doesn't necessarily need the pool noodle because the infection is really above sort of what would be her ankle. But again, I want to show you how to do that and how to wrap it and where she can get around. So yeah, let's go ahead and do that. Okay, so we've opened it up a little bit. Now in her case, this is more like more liquidy. It's not as hard. You see some of the fluid coming out. So it's not that classic yellow, as London referred to, mayo type texture. It is it's really kind of clear and straw colored. Almost like it's a cyst in there. And we're gonna take a swab and culture this again and go back and we'll submit it to the lab. The lab will tell us, we'll do what we'll call antibiotic sensitivity testing. And so they're gonna culture the bacteria and then they're expose it to different antibiotics.
Do you want me to open it?
Yeah.
Okay.
And then you can grab that red top tube and I'll just stick it in there. So if you ever do this, what we don't want to do is, again, we've cleaned everything here, so aseptically cleaned it up. Really, there shouldn't be a lot of bacteria on the surface of the skin. And when we culture, we want to do our best to make sure that, one, we don't contaminate the needle with like touching the skin or anywhere else. Although we've cleaned it up, there's still potentially some bacteria on there. So we want to make sure what we touch with the swab is the infected area and not try to contaminate with anything else. So that's really what we're trying to do here with this. It doesn't take much. So yeah, that's about it. We'll take this, you can break it, if you can break the end off in there and then just close it back up. So again here, a little bit different. So this is almost like a little cyst that's coming out. Doesn't have that classic kind of infected material look to it. But we're gonna try to get out as much of that material as possible. And some more. And again, I'm using this sterile gauze to grab onto that and try to get out as much of that as possible. Yeah, and I mean, so you can see the blood coming out of there is good. If you remember, if we've talked in the past about, blood is actually a good thing because with that blood, there's immune cells and antibodies and things that it carries too, so it'll help promote healing. And that's one of the bad things about when you have these abscesses where basically they're walled off and the lack of blood flow contributes to the infection. So blood is good. We want to see blood coming out, especially clean blood that's not that doesn't have that infected, pus type material in it. So that's always a good sign. And again, we've given her the lidocaine, so you can see she's not reacting very much when we're pushing on her leg. We're trying to get that out of there, which is good for her because this is a deeper infection that's not classic, and so it is requiring us to put more pressure on it. So it's good that we're able to kind of prevent some pain for her. So with most cases of bumblefoot, we're going to suspect that it's a staph infection. I will say this is a different presentation. It's not that classic yellow cheesy material that we're seeing. That's really, really classic for staph infection. This is more clear, like straw colored cyst type material. So it's good that we've taken the swab, and we actually may take another one. The more we take, the better, because potentially we could contaminate one. You did see that I touched the skin on the last one. Ideally, we would just get inside that lesion and just swab it. So we may do a second one here just in case something happened with the first one, and we'll have two. So if we could, double up and confirm that, both swabs had the same thing in it, it gives us a better indication of what's going on. Now remember, both feet are affected. So we're gonna do the right foot now. It's similar presentation. So again, there's not a really defined spot where it looks like it's gonna come out. So we're gonna make a small incision with this 14 gauge needle, go in and open this one up. Basically, this is a sterile flocked swab, and what I'm gonna do with this one is actually try to go into the wound a little bit, and it's cleaned it up, so it should be relatively, it's not sterile, but we've aseptically cleaned it. The blood in there is not gonna hurt anything. And we're going to work it around in that lesion, again, to try to get whatever's in there. Perfect, thank you. Now we're gonna try to express what's in there. This one's better. So we can see that material coming out. We got to it. What it really looks like is fat material. So just like I did last time, I've got a sterile gauze, and I'm gonna use the gauze to sort of grab onto this, because again, this one is, it's more like tissuey, fatty type material that's coming out. So I think it's a different type of infection that's going on here. That's why we're doing the swabs for sure. But it's not the classic bumblefoot. That material that's coming out, it really is almost like a fatty cyst kind of thing, is what the consistency of it. The color looks like that, but they pop, so they're kind of fluid filled. There we go. Now I'm squeezing pretty good because I want to try to get as much of that material out as possible. The more I get out of there, the better the ability of the antibiotic to penetrate all those tissues and get everything cleaned up. Okay. And she's being such a good patient.
She is being pretty good.
So with her, what we want to do, since it's more cyst type material and not necessarily like a lot of that infected staph, there is some tissue, some of the, basically it looks like the outside of the cystic material. And we're breaking some of that off and tearing it out. We just want to make sure when I close this up, that material is all back inside that incision. We don't want to have like a nidus for infection to come back in there, so we want a clean incision. First, we're going to clean it back up again. We're going to put some SSD, which is a topical antibiotic cream, and we'll show you how to wrap the shoe with the pool noodle. Although, again, in her case, probably not 100% necessary. But again, it's for the pool noodle is going to be for demonstration purposes. So we've cleaned everything up well. Again, you can see relatively small incision. Actually, there's two little ones here. We moved further up for the first one. Again, it's cleaned up where there's none of that tissue that's exposed there. So I'm fine with that. Again, we're going to apply some SSD, so basically an antibiotic ointment to the top of the foot. We can work this down in there a little bit. This does a good job of providing more of a lasting topical sort of antibiotic. We're also going to put Dottie on some oxytetracycline, which would be a systemic antibiotic. And again, it'll help clean up whatever the last of that little infection is. At least we hope so. And once we submit the test results too, we'll also have an idea of what that bacteria is in there and make sure that oxytetracycline is going to be effective. So this is 2 inches wide. I prefer the 1 inch wide stuff, which is what we're including in the chicken care kit for the Founding Feather members. There's 1 inch wide stuff in there, but we've got this, so we're going to use it. It'll work just fine. But I'm going to create, again, a bandage. We're going to go between her toes. And what's good about this vet wrap, if you've not used it before, one, you can shrink it down. It can lay on top of itself, and you can create that 1 inch wide strip if you'd like. But it's also, it's self-adherent, so we can wrap, and then we don't really need to use any tape. This is a temporary wrap to protect this incision. I'll rewrap it after I demonstrate the pool noodle technique. I'm going to show you how to do the pool noodle technique. So we're going to use that pool noodle as essentially like a shoe. And in the center of it, we would apply like a drawing salve. Prid would be a great example. In this case, really what that drawing salve does is moisten the skin enough to basically allow that pus and debris in there to kind of come to the surface. You know, essentially any sort of moistening agent would work. Prid's got a good consistency to it, so it's kind of sticky and it'll hold in place better, more so than what I'm going to use, which is SSD today, just because I have it. I don't have the Prid on hand. What's nice about this too is if it does break free, if you're using something that has an antibiotic in it, like SSD, it will protect that opening as well too, so it won't allow bacteria to get in there. So in this case, Dottie doesn't have the classic kernel on the bottom of her foot, but we're going to pretend like she did, right? And so we would basically put the drawing salve right on the bottom of the foot. In this case, this is a bigger pool noodle. January, it's hard to find pool noodles. So we can customize it a little bit. I am going to take a section out, shrink it down a little bit. Tell you what, first I'm going to do is cover this up real quickly. What we want to do is create this is the shoe, right? So I've got her third toe coming out of the backside of the hole. the bottom of her foot is sitting in that hole of the pool noodle. And what that's going to allow her to do, if she had that classic Bumblefoot where the lesion was on the bottom of the foot, the lack of pressure on there but her body weight coming from the top is going to it'll help to get that material out of the foot and kind of let it come out. In addition to having the drawing salve, or in this case SSD in there, that'll help it soften as well too. And again, allow that material to come out a little easier. So we're just going to go between the toes. Use those toes to help hold it on. There's another way where you can use a wider vet wrap, and a really nifty way where you can kind of trim it, the toes fit right through it. I would recommend that, but we'll post it in the comments. And you can do that way. But the 1 inch, I do like the 1 inch because again, it's thin enough or narrow enough where you can easily go between the toes. It's not gonna be binding her up too much. In her case, it was a little bit of a different presentation. So this is mainly for demonstration purposes. Remember also that we blocked her foot with lidocaine. So when I set her down, she may feel kind of like, she won't be able to feel her feet. So she's gonna be walking a little funny for a while. Usually that lidocaine will last 30 to 45 minutes or so, be less than an hour. And again, we're gonna put her on an systemic antibiotic. In this case, it's gonna be tetracycline. We're gonna do that for about 5 days, and that's gonna be given through the drinking water. Okay. Good to go. Okay, so what we've done with Dottie today is she had a case of Bumblefoot within both feet. A little different case than we usually see. In this case, I don't think it was staph. It really doesn't look like staph, but more of a fatty kind of cystic material in there. And so we did everything we could to try to express as much of that as possible. We wrapped it up, and I showed you how to do the shoe, with the pool noodle shoe. In the case of, we've got that classic Bumblefoot where it's going to be expressed on the bottom. So we've done that with her. Remember, this is a good case too where don't be scared of lidocaine. We gave her lidocaine 45 minutes ago, probably. She's fine. All it did was help us work on her feet, and she didn't have to experience the pain of us trying to get all that material out of there. So she's doing great. And Amelia, do you have any questions for us?
No, not right now. Thank you.
Yeah, you're very welcome. And thank you for letting us come out and taking care of the flock. And we're going to check back in a week or so. And we'll see how Dottie's doing. And hopefully we can give you guys an update. Till next time, I'm Dr. Blayne Mozisek, and this is the Poultry Doc Podcast. Thanks for joining.
Let's see how this... Oh, well, there you go. Walking normal.
So, yeah.
Good girl.